Hi everybody, my name is Nash, and in this video we will talk about wound infection. So let's assume that this pillow here is actually the patient's body. Now it doesn't necessarily have to be their abdomen or their thorax, but it can also be like, for example, their arms or for example their legs. And the tissue right here, we'll be using it as the injured side. So let's say the patient had a cut at the legs. So we'll represent the cut with the tissue. So any symptoms of infection will be demonstrated on this part. Alright? Always remember to put on your gloves. Symptom is to see any noticeable changes in the growth of the wound. For example, you can see that the wound is actually at this site, and now it gets bigger, and then you can see it becomes even bigger than before. So this will be the first symptom of infection. As you can see, the site at the wound has begun to spread into a larger area. The second symptom will be the discharge of pus or any fluid that produces foul odor. If your patient's wound smells really bad, then it could be a sign that the patient might have wound infection. You should also assess the pain from the patient by confronting them and ask how do they feel about the pain. Hi, good morning, Mr. Reiner. My name is Nash and I'm here to check you up. So can you tell me how do you feel so far about the injury that you have? Next symptom will be swelling at the affected area. Now let's assume that this is actually the part of the patient which is injured. In case there's an infection at this wound area, swelling can appear. Like for example, you see that the wounded area has now become bigger than before. Also, don't forget to measure the patient's body temperature. If you do not know this, normally patients with wound infection would complain about fever and chills. So if you can measure the body temperature and record it, when we can able to identify whether the patient actually got a wound infection. And finally is to observe any redness or inflammation at the affected area. As you can see in this picture, the blue spot is actually the place where I got my cut. Instead of taking care of this wound, I chose to ignore it. Because of that, I got inflammation of my skin. As you can see, the skin surrounding the wound has become red. This shows that my wound has actually been infected. So redness and inflammation surrounding the site is a good indicator that you have wound infection.